Hello, my name is Christina Logan, a doctor of pharmacy and current resident at Cooperman-Barnabas Medical Center in Livingston, New Jersey. This presentation on immunization awareness was developed in partnership with the Rutgers Ernest Mario School of Pharmacy and the Barnabas Health Retail Pharmacy here at Cooperman. This presentation comes to you in a couple of parts. First, it will discuss background, vaccine basics, and the concept of herd immunity. Then it will discuss influenza or the flu, rates and trends, as well as effectiveness of the vaccine. Similarly, COVID-19, rates and trends, and the effectiveness of the vaccine, as well as 2025 COVID-19 vaccination recommendations. And it will wrap up by discussing building vaccine confidence, communication strategies, and some resources and services that are available. Vaccines, at their most basic, are a delivery mechanism for instructions. They are typically an injection into the muscle or just under the skin. Vaccines contain a part of or the whole germ as a blueprint for antibodies, which are like the soldiers of the immune system, to recognize and be ready if they meet the real germ down the line. Vaccine delivery mechanisms can be different. The classic is a live attenuated, where the vaccine introduces a version of the germ that is weakened. It can replicate inside the body, but it cannot make the body sick. The inactivated vaccine introduces an inert or dead form of the germ that cannot replicate or make the body sick. Subunit vaccines introduce some part of the germ that the body will learn to recognize if it meets the whole germ later on. Toxoid vaccines are unique in that instead of introducing the germ or part of the germ, they instead introduce the body to the actual toxin the germ produces, which makes the body sick and causes symptoms. The mRNA vaccine introduces proteins which make a part of the germ inside the body, such as the proteins or flags on the outside of the germ, so that the body can learn what the germ looks like. Viral vector vaccines are built by taking an inert or inactivated form of one germ, such as the flu, and dresses it up with one or parts of the germ the vaccine protects against, like a delivery vehicle to bring those instructions into the body. The flu vaccine is currently available in an inactivated form as a live attenuated vaccine or a recombinant vaccine, and the COVID-19 vaccine is available as either mRNA or a protein subunit vaccine. Different factors will influence when a person should get the vaccines, such as their age, risk of illness, underlying health conditions, special situations such as being very young, being very old, or being pregnant, or having any kind of immunosuppressed state. Protection onset, or when we expect those instructions we deliver via the vaccine to be memorized by the body, for the body to be ready to act, as well as how long we expect that protection to last inside the body, or the memory of those instructions to last. Herd immunity provides indirect protection to unvaccinated individuals, again, those who are very young, very old, or pregnant, who cannot themselves receive the vaccine. Herd immunity reduces the risk of outbreaks. The idea is that if a germ comes into the community and very few people are vaccinated, it has a lot of people that it can spread through very quickly. However, if many people in the community are vaccinated, the germ cannot spread as quickly or as far. So those people who could not get the vaccine are protected not by the vaccine, but by their community. Vaccines are approved through the FDA. The Center for Biologics Evaluation and Research regulates vaccine approval. Vaccines usually require 10 to 15 years of laboratory research to be developed. Their immune response is first studied in animal models, and then we move on to human research. Phase 1 is small groups of healthy volunteers to test safety. Phase 2 is bigger groups, where we now assess efficacy, how well the vaccine works to protect against the illness. Phase 3 is even larger groups, where now we are assessing safety and efficacy, as well as a side effect profile. After Phase 3, the vaccine will typically enter the market. And then Phase 4 starts, where after licensing, after the vaccine is in the general population, we continue to see if it is still effective and what other side effects do come up. Which vaccines are recommended when comes to us in schedules like this. This schedule can be complex to read, but we'll start at the top. Across the top, we have our age ranges, 19 to 26, 27 to 49, so on until we get to people who are 65 years and older. And down the left-hand side, we have the germs or illnesses of concern, COVID-19, influenza, RSV, so on. By finding the age group that we are interested in and the vaccine or illness that we are interested in, we can see what the recommendations are from expert panels on who should get the vaccine, when, and how often. This can still be pretty complicated to read, so if anyone has questions, they should reach out to a pharmacist or other healthcare provider. The flu or influenza can affect all of us, but there are certain high-risk populations that are at severe risk for more hospitalizations, more severe illness, and more severe complications. High-risk populations include those who are 65 and older, children under the age of 2, people with chronic conditions, those who are pregnant, and those who live in conditions such as nursing homes, long-term care facilities, students going back to college who live in the dorms, those who work in hospitals, so on. Technically, the influenza virus is present year-round. You can catch the flu in the summer months. However, we do statistically see an increase in October with a peak in the December to February months. Flu starts to circulate in early October, and that's why vaccine campaigns tend to start in September. The idea being that when we deliver those vaccine instructions into the body in September, the body will have time to learn those instructions, memorize them, and be ready when peak starts in October. Global experts do watch trends in viral strains around the world to predict what will be the most common come flu season to make the best recommendations for what should be in the flu vaccine, who needs to be covered, how at risk we are, and other things. But again, the flu is present year-round. Looking at flu burden annually, this graph breaks down what flu burden is. The gray is illnesses, yellow is hospitalizations, and the red peaks are the amount of deaths. Seasonal impact does vary year to year. From 2011 to 2024, there have been 41 million illnesses, 710,000 hospitalizations, and 52,000 deaths. While it does vary year to year, we do know that it is preventable. The flu vaccine we know is effective. It does reduce that serious illness and hospitalizations. It can reduce hospital visits by up to 60%. However, flu vaccine does vary season to season. We talked about those global experts who view global trends to see which strains of the flu virus should be included in the vaccine, and this can change. Illness severity changes, how spreadable the illness is changes, but we do know that vaccines are effective regardless. Some new developments in the flu vaccine is that we have a nasal spray available on the market. It's available to be given by the patient to themselves, or a caregiver can administer it, and it's approved for people ages 2 to 49 in the United States. A recombinant vaccine flu block that was on the market previously has been approved for ages 9 and up now, so we've expanded who can get this. And the majority of vaccines on the market right now are either preservative-free or low thimerosal if that is a concern. COVID-19. Looking at rates and trends for the COVID-19 pandemic, we see that starting in January 2020, moving on through August 2025, our most recent data, there have been different peaks and trends. The blue is weekly deaths attributed to the COVID-19 pandemic, and the orange is emergency department visits wherein COVID-19 was diagnosed. When we compare it to the peaks we saw with the flu, there are multiple peaks throughout the year, not just in the winter seasons. And while we do see that vaccines were introduced in 2021, deaths have reduced over time, and this is for many different reasons. Weaker strains, the strains are different, social distancing, information campaigns, but we do know that the vaccine does help reduce rates and emergency department visits. For COVID-19 in adults, there was a 33% added protection against emergency department or urgent care visits. For adults who are 65 and older, there is an added 45% added protection against hospitalizations and a 40% added protection against hospitalizations for those who are immunocompromised, 65 and older. The Advisory Committee for Immunization Practices, or ACIP, is an advisory committee within the CDC, which makes clinical recommendations on vaccines. They have not met for the 2025 season yet, so we do not have their official recommendations or the schedule published for 2025. By the time you see this presentation, info might be different. Please follow up with good sources of information. However, we do have recommendations from the Centers of Disease Control. Adults 65 and older should receive the COVID-19 vaccine in 2025, and anyone who is under the age of 65, adults under the age of 65 with underlying conditions. Again, we don't have the published suggestions for this year, but reflecting previous years, underlying conditions have included things like diabetes, COPD, asthma, and heart failure, among others. The American Academy of Pediatrics has separately recommended children 6 to 23 months are at increased risk and should be vaccinated unless contraindicated. Those 6 months to 18 years should also be vaccinated according to their vaccine schedule. Again, this can all be discussed with the pediatrician, a pharmacist, or other healthcare practitioner. Effective September 8th, 2025, the New Jersey Department of Health has issued an executive order to support broad COVID-19 vaccine access in the state. Anyone over the age of 6 months is eligible, and those over 3 years of age can get vaccinated at the pharmacy without a prescription. Building vaccine confidence. This is an important component of keeping our communities safe. There is the 3C model of vaccine hesitancy, or how to communicate and combat vaccine hesitancy. Starting with complacency, confidence, and convenience, these 3Cs work together to build vaccine confidence. First, we'll start with complacency. This is where the perceived risks of the vaccine-preventable diseases are low, and the vaccine just isn't deemed necessary. So we'll hear patients often say, the flu doesn't seem that bad. I get it every year. It's okay. I don't need the vaccine. This kind of goes into convenience. So for physical availability of the vaccine, affordability, willingness to pay, these are all important factors in whether getting the vaccine is quote unquote worth it to the community member. If they think that, well, the disease that I'm preventing isn't really that serious, they might still be interested in getting the vaccine for that herd immunity effect or for family members who can't get it, etc., if it is convenient to get it. So we want to make sure that the vaccine is physically available, it's affordable, but we also want to make sure that there are community drives and other things that give people access to these vaccines. Geographical accessibility can be a barrier. A lot of our community members do live in what is called healthcare deserts, where they may not have access to a doctor or pharmacy that can conveniently bring them to the vaccine. There's also the convenience of the ability to understand the purpose, understanding those concepts of herd immunity, illness severity, hospitalizations, and death, not just for you, but for community members. And we want to make sure that immunization services are, at the end of the day, appealing to people. All of this, discussing complacency, building convenience into the vaccine administration model, will build confidence. We want our community members to have trust in the effectiveness and safety of vaccines and the systems that deliver them. By discussing the things that make people complacent with not getting the vaccine or having the vaccine not be convenient to get, will make people more confident in getting it. Now, the conversations around a vaccine hesitancy, we have some communication strategies. We want to make sure that we're providing the correct information, but we also want to give these recommendations with clear confidence. Of course, when you start these kinds of conversations, we want to make sure that we are getting consent. So start the conversation by, hey, can I give you some advice? You want to acknowledge empathetically that there's a lot of concerns around vaccines, whether they're convenient to get, whether they're out of someone's price range, or there's a physical or transportation barrier, or maybe even an information barrier. We want to clarify and reaffirm that most people do know that there are some important things about vaccines and engage them in those conversations. But we also want to share appropriate information and modify misconceptions. You'll often hear, well, you can get the flu from the flu vaccine. Why would I put myself at risk of that? We know that the flu vaccine does not cause the flu itself. It will protect you from it. Unfortunately, when you receive the vaccine, when you receive those delivered instructions and the body is memorizing those instructions, it can ramp up a response that looks a little bit like you're getting sick. So we want to provide that information empathetically and with understanding to our community members. And then again, we want to highlight those collective and individual benefits. You're protecting yourself, but you're also protecting people in your family and in your community that can't get the vaccine. Resources are available. So the Centers for Disease Control and Prevention do publish those vaccine schedules and current recommendations. The Food and Drug Administration does publish vaccine information, approval, and etc. We do have those information on different vaccines that are available, such as the new flu vaccine, nasal spray. The World Health Organization provides global vaccine information in patient-friendly language very often. And Immunize.org has information for both professionals and patient-friendly language that will further bring you resources on what is safe, what is available, and how to discuss vaccination. The Barnabas Health Retail Pharmacy and the Ernest Mario School of Pharmacy at Rutgers work together to provide community outreach programs and events. This presentation was made in collaboration with the Community Health and Outreach team at Cooperman-Barnabas Medical Center, which coordinates many different vaccine clinics, health screening clinics, and health education presentations across Essex County. If you are interested in any free community programming, please call the Community Health and Outreach team at 973-322-2516. To wrap up, vaccines are an important part of public health, keeping our communities healthy and safe. It's important to stay informed, share good resources, and build confidence in them. Thank you.